outcome number 2 requires me to develop a program of learning within my professional situation to enhance the learning experience. Therefore, I'm going to discuss the issue of the change within the program and how this will enhance the teaching and learning experience for the learners. This will also include research of the issue itself, for example, the asynchronous digital remote learning package, as you can see on the screen, which is currently being implemented as part of teaching for 4006, and it will identify any relevant and current research and good practice within the area. So I'm just going to quickly note that this module is 4006, but this package is a second year module designed for a second year module for 5006, which is a lead on level 5 study, as opposed to the current program in which this is introduced, the module that it's currently introduced into, which is 4006. So the learning package is implemented as part of year 1, and it is then duplicated in terms of year 2 as well. So I'm just going to show you a brief demonstration around the current Numeracy Flipped Classroom session, and then later on provide an overview in terms of the newly developed initiative, which is the numeracy package for 4006, which is specifically designed for level 4 study.
Welcome to this theme session, which is part of a series on the Medicines Management module, but adapted for other modules also.
So on your screen there, you can see some very static images and some very basic functions, which is next, back and home. Now, for those who have basic digital literacy skills, it would be quite easy for someone to navigate around this flipped classroom learning. However, at the beginning of the session, there isn't an instructional video which provides guidance for users going through this session. So just linking back to SAM in 2011, access and motivation is a very important aspect in terms of setting up the system and then accessing the system. And if this isn't included correctly prior to the student engaging with digital platforms or digital learning platforms, then it's going to inhibit access amongst students. And medicines management is a really important aspect of nurse education, as it is one of the things that nurses do on a regular basis in some settings, but also if done incorrectly, it can have some really negative effects in terms of adverse patient harm, and in some cases can lead to never events, which can lead to mortality amongst patients in which nurses are looking after. So really, within this section, there is a very brief overview in terms of welcoming and encouraging. There isn't any instructions in terms of what the users need to do, although it is made obvious through the 3 buttons at the bottom. And we will continue with the rest of the package.
Please see below here the relevant learning outcomes for module NRS 5006.
So on this page, the information is presented on a white background, and the learning outcomes are aligned to the module. But unfortunately, these learning outcomes are aligned to the module of 5006 and not the learning outcomes for 4006, with 4006 being a level 4 study and 5005 being 5006 being a level 5 study. So again, the information isn't always aligned to the curriculum or isn't aligned to that specific module learning outcomes.
This workbook will help you develop your competency in numeracy skills of all the medication errors successfully reported to the National Reporting and Learning System. Wrong dose, strength or frequency were the most common type of error.
So within this section, there is accompanying text with some audio overlay, but again, the information is quite convoluted or can be quite difficult for those students who require easy access to information that is being presented. There also isn't any search functions within this flipped classroom learning session, so that students, if they wanted to revisit a specific section, they would have to navigate to the page, maybe clicking a number of times to get to the desired information. So it's really important to bear in mind the accessibility of the information being provided at this point.
This workbook covers a variety of numeracy-based tasks which nurses are required to perform in practice. But think about what a nurse does regarding medicine administration. Remember the process: medicines are described, they're procured, they are issued at the point of use, medicines are administered to patients.
So at this point, there's a real lack of engagement between the information being presented and engagement with students and their peers. So with face-to-face learning, the teacher is almost in the boat with the students, steering the course of the direction and the knowledge that is given. But with online learning, the students are almost scattered out there, maybe in the waters with their own vessels, and the teacher needs to guide them from a distance. So therefore, preparation is really key in terms of providing basic interactions at the beginning of a learning package to make the student more familiar with the structure of the package being delivered.
The workbook has the following chapters. First unit's about commonly used abbreviations with NHS.
So here is an example of that. The narrator is providing an overview to the structure of the programme, which makes it a little bit easier in terms of function around the flipped classroom learning package.
In this chapter, we're going to look at commonly used abbreviations. Can be confusing. It might seem like a different language you have to learn. It is important to know what these are when working in healthcare. The next slide visits some commonly used abbreviations. So you'll be familiar with some of these. How do you write these abbreviations in full text?
So at this point, the narrator is asking the student to come out of the package to undertake a task. Now again, Salmon 2011 and Selwyn 2019 really advocate that once a student is within an e-learning package or a digital remote learning package, that interactions outside of that package should be kept to a minimum to really encourage a sense of engagement with the learning materials being provided. So again, this is another downfall in terms of the information that is being provided as part of this section of the flipped classroom learning package.
You write these abbreviations in full text as below and the words as indicated.
So at this point, the answers were already provided to the students without them having the option to continue. So this really inhibits that formative inner feedback that David Scholes talks about, David Nichols, in terms of providing the learner with the opportunity to reflect on their own practice prior to having the answers presented to them.
Going a step further, NH Trust policies typically require you to write in particular ways as shown in these yellow boxes.
So just having a look at the accessibility functions or the accessibility of the information being provided within this chapter. There is a model available called Sculpt Model, and that's looking specifically at structure, colour and contrast, use of images, links, plain English and table structure. So just looking at the structure, the use of headings to ensure that text flows in the right order on the slide, and at the minute there is a heading up at the top but the majority of the information isn't always labelled correctly. And looking at colour and contrast, so colours selected need to ensure that they maximise contrast and not convey information. And at the minute, there is a conveyance of information in terms of the images being used. So as you can see on the bottle there, the dose is 5 milligram per 1 mil, and that is then translated into the image, which is conveying information and not always maximising on the contrast and looking at what the image is trying to depict. And again, the use of colours as a background might not be useful for those students who have additional learning needs and might not be able to see the information as clearly presented to them. So just moving on to the next slide.
We'll now look at the International System of Units. This is the modern form of the metric system and is the most widely used system of measurement.
So again, the information is presented on different colours within the background, which can stop the user from actually engaging with the text. And there is a lot of information on this slide, although the images really do complement the text.
First, the SIU. So now moving on to converting units of weight and volume. If you want to convert from big to small, you multiply by 1,000 by moving the decimal point 3 places to the right.
So this image for some students might be distracting or not accurately portray the information that is needed. The imaging is distractive with the overlay of the audio content, and this can be especially difficult for students to understand a new concept that is being introduced without the basics firstly being introduced. So the student at this point hasn't had an opportunity to gauge where they're at in terms of their learning journey, and they've not able to maybe do a self-identification of the level of knowledge or their level of skill, which Salmon again 2011 really supports the use of engaging users with low stake activities and formative assessments, which enable students to gauge their level of understanding at that moment in time. Now this is also supported by Rosenshine and also the cognitive approach to learning in terms of providing small low stake tasks in order to scaffold that knowledge over a period of time.
If you want to now try these short quiz questions to check that you understand how to do these conversions. What is your answer to this conversion? Scroll here to view the correct answer with the rationale.
So at this point, the learner is encouraged to work out the answer, and the answer or the correct answer that the student comes to or doesn't come to will then show a working out. And this is a really good example of formative feedback being provided to students, for them to construct a schema around understanding that new concept.
What is your answer to this conversion? So to summarise this chapter, we explored common. The next slides show a number of principles about calculating oral doses in tablets. Now click through these slides to read the different principles.
So at this point, it's asking you to read the text on the screen, but there isn't a function for those students who would prefer a audio version to be spoken to them.
When calculating, in this segment, now try how many tablets would you give for the correct dose? Click over the blue box for the answer.
So at this point, it's asking you to click over the blue box to reveal the answer, but if a student accidentally scrolls over the box, it will provide them with the answer before they've managed to work it out. And this can sometimes demotivate students who would otherwise be motivated to calculate the calculation required.
How many tablets would you give for the correct dose? Click over the blue box for the answer.
And again, this is seen within this slide as well.
How many tablets So far, we looked at units of medicines and calculating the number. In this chapter, we'll examine the number.
So from the user perspective, it can be very monotonous and very click happy in terms of clicking the next button to continue. And there isn't that element of scaffolding or building upon knowledge. So at this point, I'm just going to share the example that I've created as part of my action research and talk around some of the theories and good practices as to why I've implemented this flipped classroom learning. Now, just a point, within my action research, there is some data around the evaluations, both quantitative and qualitative data, which one of the questions specifically relates to comparing this package to a previous package as well. Now, it's interesting to note that 7 of the participants strongly agree, 13 agree, 7 neither disagree or agree, 1 disagree, and 2 strongly disagree. So the majority of the students or learners who have undertaken this implemented flipped classroom session either strongly agree or agree that it is better than the previous version. So just within this flipped classroom learning, as part of my implemented action research, this platform will be housed on the NRS 4006 Moodle page, and students will be able to access that as well. What I've also done in terms of relating it back to access and motivation within Salmon's 2011 model of teaching and learning online through online networking is I've created a very short instructional video which provides users with an overview to some of the systems and processes that are implemented as part of this session. That includes things such as accessibility functions, searchable functions, and also a formative numeracy examination which can pull into the Moodle platform. And this provides an overview to tutors and lecturers about the attainment that those students are getting as part of that formative feedback. And that formative examination is comprised of previous summative examination questions. So like for like, there is a comparison, and it will engage students to undertake that assessment at the end of this flipped classroom learning. So in terms of accessibility functions, the flipped classroom learning can be accessed by a laptop, by a tablet, and by a mobile phone device. And it will automatically reconfigure depending upon what device the student is accessing the package from. So I'm just going to show you the desktop version, and prior to the session, the students can start to look through the content of the session. And again, it is broken down in terms of scaffolding of knowledge. So there is a diagnostic numeracy test, there's an addition and subtraction, common abbreviations, going right the way down to number 9, which is calculation in children's. Now at this point, it's really important to note that during this module, other branches of nursing do join together, so that's mental health and children's nursing. And one of the things that I noticed within the original flipped classroom learning that was implemented is that there was no specific teaching or resources available for other branches of nursing. And the content does differ very slightly, and in some cases quite drastically, because medications management does differ. So, for example, if we're administering a medicine to a child, it's often prescribed on weight, whereas in adults, that isn't often the case. So, in terms of promoting inclusivity, it was really important to, and because it's mapped to the current curriculum, which is being validated by the NMC, it's really important to include that additional branch of nursing specific information and learning within this package. So just having a quick look at the package now. The package is easily accessible. Text is presented in a very clear way. The links make sure that text used for links is meaningful and informative, and there is not any click here or full web addresses displayed within the actual package, which again aids accessibility. The uses of images and videos are relevant to what is being delivered in terms of teaching, and the structure does use headings and styles and ensures that text flows in the right direction, both within the package and also within the end section, which provides an opportunity for students to go on and do further study. So just looking through now in terms of the actual resources, the package does have digital capacity to interact on a individual basis with the learner. So for example, if I wanted to look on a specific topic and I was revising for an exam, or I've identified that I'm not too strong in a specific area, before undertaking the formative assessment, I can just type in addition, for example, and all the search results will show up within the package for that search term. But right now I'm just going to take you through the diagnostic numeracy test. So this provides a formative opportunity for learners to self-assess where they're up to and their current skills and knowledge base. So for example, this question here is, if I was to calculate this, 625, and pop the answer in, it provides the feedback to the student that it is the correct answer. And also note that I have put various different answers within there, just because some students may put a comma, and if they do so, it will show up as an incorrect answer, even though it's a correct answer. So it's really important that there are variations in the answers, not to confuse students or to give students the wrong information. Now just going to the next question, if I was to put 2000 into here, it will show then that it's the incorrect answer and that the acceptable responses or the right answer was 2134. Now again, the content of this flipped classroom learning has been mapped to the curriculum and to the relevant learning outcomes, which is learning outcome number 5. The students will go on to undertake a summative numeracy assessment with a pass mark of 70%. And some of those questions all of the questions within those summative examinations have been analysed, and the concepts have been constructed and delivered in a different way to ensure that scaffolding of knowledge. So there are occasions where nurses need to multiply and divide in terms of working out conversion rates between different units of measure. But instead of putting all that information in there to begin with, we've just asked the students to do a very simple multiplication, which doesn't provide a context as to why they're doing it. For example, the question here isn't convert to convert micrograms to milligrams, it's a very simple 0.025 times 1000. And then when we get to the common abbreviation section later on throughout that package, those concepts will be applied, which will help those learners acquire knowledge and apply other concepts to new concepts. It's really important to note as well that students who are entering this programme of study already have a basic understanding of numeracy, as it's a requirement from both the NMC and also the admissions process that students do have a grade of C to A star within GCSE numeracy, or they've got a level 3 functional skills in order to access the pre-registration nursing programme. And again, there's other examples in terms of units of measure. Now that we formatively assessed if they're able to do basic calculations such as multiplication, we then start introducing terms and concepts that these students may not be familiar with. And because these students are first year nursing students, they may not have come across converting units between gram and milligrams. They may not already have that functional knowledge. So we do provide context in terms of why it's important to convert accurately between units and measures. So this is replicated throughout, and there are some work-based questions so that when the students do progress through the e-learning package, that it's almost not a shock to them. It's already familiar at the early introduction of the package to them, that there will be worded questions that do include some numeracy-based questions. And this really helps in terms of socialising students to some of the content within the curriculum, but also some of the content within the learning outcomes which need to be achieved. So it's really around building that learning environment on a digital platform which encourages socialisation with the package. And then at the later stages, we'll be going through information exchange, knowledge construction, and then the development of the package itself. So just looking at the addition and subtraction question, now that the students have undertaken a formative assessment, they have been able to formatively assess where they're up to in terms of their learning. So if they're able to multiply and subtract or do additions quite easily, we're now introducing concepts specifically to nursing practice. So for example, addition. Addition is a skill that is required when calculating a patient's fluid balance chart. So we're applying the concept of numeracy and then applying it to a nursing specific task or a skill in which we need to undertake. So here there is an example of a very basic fluid balance chart. So students are encouraged to calculate the fluid balance chart and then answer the question below. And again, this is also included within subtraction, where students are encouraged to subtract the input from the output and come up with the patient's fluid balance for that given moment in time. And there is also some handy tips in here in terms of what to look out for, not only in practice, but also within the summative examination as well. So there is at the start of each of the lessons a very brief introduction in terms to some of the content that is going to be covered as part of the session. Now, this section relates directly to that online socialisation aspect of Salmon's 2011 model, and also the interaction and e-activities which are needed to be introduced at this stage. So here is a very low stake task of matching the abbreviations to the correct unit. So kilograms, for example, kilograms and milligrams, grams to grams. So at this point, it requires 100% to pass. So if you was to review the quiz, it would then tell you which answers you did not get correct, which again is a really good formative feedback opportunity for students, because students often learn from their mistakes, and there is an option to go back and retry the quiz again. So if I was to click all the correct answers this time, click submit, then it shows that the student has got 100%. There is also a function for students to print their results as evidence of learning, so it will provide a transcript of the results if module tutors require that as part of an activity, and so that students can evidence undertaking that activity as well. So there are also other interactions within the flipped classroom learning. So for example, you may notice above that there are some abbreviated words, for example, grams to G, kilograms to kg, but nanogram and nanogram is wrote twice, and microgram is wrote twice. So without providing all the information around why we do that, it's a really good opportunity for students to look at this package to ascertain why that is, and then move on to the supported learning down at the bottom. And again, this is really supported by Gilsup, Bolton and Williamson 2018, who suggest that this is a good way of presenting information to learners, as it really enables them to explore concepts and ideas prior to receiving the theory. So again, there is also more interactions within this section. Now down at the bottom, in terms of reducing that theory practice gap, which is something that we talk quite a bit about in nursing practice, there is an example of a real life prescription which shows why it's important to have a look at prescription charts really in depth before you administer a medicine. So for example, the amoxicillin example that is provided there, there is a decimal point, so 3.0, but it's not advisable to write a prescription this way. So in this situation, we're teaching the learners not to administer that prescription and to actually go back to the prescriber themselves, because if they did understand that it was 3.0 grams, they might on that occasion, but their colleagues who come after them may interpret that as 30 grams. And there is also an explanation and further links there which take you to additional resources if you would like to. So in this section here, there's a very simple diagram which provides an overview in terms of how to convert between units. And this information is supported by audio functions as well if needed. And again, reducing that theory practice gap, we are putting some real life scenarios in there with a chance for students to gain some formative feedback on their numeracy, calculations and abilities. So again, this is replicated throughout the e-learning package. Now at this stage, we've started to include some new technologies which our students in the University of Bolton, due to the diverse communities in which we deliver teaching to, prefer information in differing formats. And what we do find, based on the evaluations that we gather, is the students prefer Zoom sessions to flipped classroom sessions, and that's often because they can explore and discuss ideas and have a live working out of a question, which can really have a profound impact on learning. So I've really gone away and thought about this and had a look at the activities as part of Salmon's 2011, The Key to Active Online Learning. And what I've done is I've provided the learner with the question above, and if they get the question right, then they may choose not to have a look at the explanation below. But say, for example, a learner just couldn't understand the concept of the information that's being provided. Where did they go next? Who did they ask? And again, it's around creating that online socialization to promote information exchange to then construct new knowledge. So here's a very an example of a explanation and a demonstration of how to work out the above question if the student decides to access it.
Patient X has been prescribed 0.75 milligrams of drug A to be given orally. Stock on hand is 750 microgram tablets. How many tablets should be administered? So from this question, you might identify that we're not working in the same unit of measure. So the patient has been prescribed 0.75 milligrams, but the stock on hand is 250 micrograms. So firstly, we need to convert 0.75 milligrams into micrograms to ensure that we're working in the same unit of measure. So 0.75 milligrams times 1000 equals 750 micrograms. So now that we've got the correct unit of measure, we now need to pop the information into a formula. So you may find the following formula useful. So strength required divided by stock strength times by 1. So the strength required will be 750 micrograms. Divided by the stock strength, which is 250 micrograms. Times 1 equals 3 tablets.
So that demonstration really shows how it could be beneficial for some users to have a live working out of a question and also apply the formula to the question that is being provided. Now, designing and structuring online learning, it's a little bit like being a coffee barista, and it can look very straightforward, but it requires a surprising level of technical skill, theoretical understanding, and creativity, which is developed with time and experience. Now, what I've used is a model called LATTE, which is learning units, activities, timing, tools, and environment. So the learning units are really pulled from the curriculum and the learning outcomes. So what do we want our students to learn? That's a really important question when we are going through and developing these e-learning activities. And that's something that I've really taken away from Module 1 in terms of asking the question of what do we want our students to learn. The next thing is by creating the activities to actually meet that expectation of what we want our students to learn. So do we want our students to pass a summative exam, or do we really want our students to be able to practice proficiently and safety to ensure and promote the safety of patients that they look after? Now the timing has to be really on cue with some of these activities, as the activities need to link directly to the information and learning that is being delivered. The tools need to be accessible, interesting, engaging, and housed in an environment in which fosters that ability for students to engage and interact with the learning platform. So this is a very quick overview of the information and the learning provided as part of the Medicines Management Workbook, which does differ significantly to the previously implemented flipped classroom learning. Now, as an addition to this, we provided a formative numeracy exam, which is very much likened, as previously discussed, to the summative examination. And this provides students with an opportunity to undertake an examination which is comprised of 25 questions, which will then generate a percentage score for that individual. And this enables students to gauge where they're at with their level of understanding and knowledge to see if they are prepared for their summative exam, but also if they are proficient and safe practitioners out in practice. Now, a step further, this information is also available to lecturers and teachers within that specific module. So just go into the module homepage